Hey everyone, welcome back. Today I want to talk about some tips for clinical medical students and how you can make the best out of your clinical years. Because let's face it, right? Clinical years are tough, they're not easy. Pre-clinical years, all you had to do was study, and that's hard on its own. But in clinical years, you suddenly dropped into a new team, you have to learn all sorts of new things like how to present patients, how to see patients first of all, how to do procedures, you have to rotate through new blocks all the time, work with new people, and learn all sorts of new skills. So today I thought I'd be giving you just a few tips on how to make the most of your clinical years. So the first one is seeing patients. And you may think that's obvious, which it is, but it's also really important because seeing patients forms the bedrock of what kind of doctor you're going to be. And one of the most important learning tools you'll ever have is seeing patients while you're a student. Because when you're a student, you have time that you don't have when you're a doctor. You're not the one treating that patient in the end, at least not most of the time. So you have more time to learn from that. And you may say, yeah, well, I've got to study, I've got assignments, I've got exams coming up. I don't have time to go see more patients. And I understand that. I was in the same position. You kind of want to sacrifice seeing more patients for learning the content that's actually going to let you get through medical school. Now, that's valid. And if you really feel that you're at maximum capacity, and you can't see any more patients, then what I'll say to you is, okay, that's fine, but then apply what I'm going to tell you to the patients that you actually see already. And if you do have more time and more energy to see more patients, take the opportunities, whether it be clinics, whether it be in the wards, whether it be a fellow student saw an interesting patient and the patient consents for you to talk to them as well. Take the opportunities to learn new things. Now, when I say seeing patients, I don't mean just going, doing a history, doing an exam, and leave. Take the time to learn from that. Do your history, do your exam, figure out your own conclusions from there. Then check the file. See what actually happened. See what tests they did. See if they picked up anything that you missed. If you have that opportunity to learn from each patient that you've seen, you can actually learn so much by the time you get to the end of your clinical years, by the time you graduate. Tip number 2 is also regarding seeing patients, but it's slightly different because when you're seeing patients, you may not be doing the optimal things for your learning. So tip number 2 is present patients. Present as many patients as you can. Right? Present to the specialist, present to the intern, present to other students if they let you, right? Just so you can gain some experience in presenting. Because in presenting, you'll learn things that you didn't know. You'll find mistakes that you made. You'll find things that you learned that maybe someone else missed. Someone else found that maybe you missed. So by presenting, you actually solidify the knowledge you gained by seeing the patient. And you're also accountable for having seen that patient because someone has now told you, okay, this is what you did right, this is what you did wrong. And from there, you can take that to your next patient and you've done better already. Presenting sometimes feels like a chore and it's really nerve-wracking. And especially if you haven't done a lot, you can be very nervous about presenting, especially to more senior doctors, because you feel like you have no idea what you're doing. And if that's true, then I would advise you to check out this video right here, where I actually talk about how you can make your presentations better and how you can present better on ward rounds. Because if seeing patients is the number 1 thing you need to be able to do, right? Number 2, especially when you're a junior doctor, you need to be able to present those patients because you need to be able to tell the team of people that you're working with what's actually happening with that patient. And if you don't have that skill, the best way to get it is to practice it and to do it more. Tip number 3 is do the procedures. Don't shy away from doing procedures. Whether it's taking bloods, putting in an IV, putting in a catheter, learn from that. You might not want to, right? Some procedures you might think are gross, which you're just going to have to get over because you'll do them all by the end. And some procedures you may just feel self-conscious, like you don't know how to do them, or they're out of your skill level. In that case, ask someone else for help. Ask someone senior to you to help you. Ask someone to show you how it's done. So take the time now and learn to do those things early, because by the time you graduate, you already know how to do them. And when you're doing them as a student, there's always someone you can call to help you if you get it wrong, or if you're not sure what you're doing. There's always someone to oversee what you're doing. So take the opportunity you have to improve your skills as much as possible while you have that opportunity. Even if you're a 4th year, if you're a junior clinical student, you don't know what you're doing, Ask someone, look, I've never taken bloods before, can you show me how to do it? I've never put in an IV before, can you show me how to do it? And more often than not, people will show you what to do, and then it's a win for both parties, right? It's a win for you because you now have a new skill, and it's a win for the team because if there's work to be done, you can now help out with that, which also enhances your own learning. Now, tip number 4 is about teamwork, right? Build relationships, build networks with the people that you're working with. And by the people that you're working with, I mean the doctors, I mean the interns, the nurses, the other students that you work with. Build those networks. Get to know people. But don't be phony about it. Because people can sense when you're being phony about it, and no one likes that. But build those networks. Because teamwork is a skill you'll need to work as a doctor. And if you build that up over the years, and you get to know team dynamics, you'll be able to work in pretty much any team you get to much more efficiently. Plus, it'll make your time a lot more pleasant. If you're working with senior doctors, right, ask them during your rotation what it is you're doing right and what you could improve on. By doing that, it helps out, again, both parties, because you now gain some insight into what you can improve on, so you know what to improve on. And for the rest of the time that you're there, they get benefit because now you're actually working on improving that, which improves the team. So again, it's beneficial to everyone. And tip number 5 for clinical years, and I think this is also really important, but it's not something that you'll probably be told a lot, is don't be too hard on yourself. Right? Don't expect yourself to know everything on day 1. Don't expect yourself to know everything by the 2nd or 3rd week of the block even. Just do your best to learn as much as you can during the time that you're there. The point of it is not to be an expert by the time you leave. The point is to be competent. And by learning competence and doing your best to learn about any gaps that you may have, you're already helping yourself out. Remember, what's unique about medicine is that you are always surrounded by people that are very senior. That consultant may have 20 years of experience in that field. So you're always working with people who have 2, 3, 5, 10 years more experience than you do. So you're always going to feel like you're behind because you are talking to people who are literally experts in those fields. You are working with them daily. So don't feel that you are not doing enough if the end of the block comes and you don't know as much as they do. The point is to be competent, to be able to know what your limits are, what you know, and when you need to say, okay, I don't know, I need help. Remember, clinical years are hard enough already. If you're harder on yourself because you think you're not coping enough, you're not doing yourself any favors. Give yourself a break. You are learning. You are taking the time to do what you need to do. And that's all you need to do. I hope you liked the videos. If you do, subscribe to the channel for more medical student study tips and more practical advice on how to be in the wards. Like the video and leave a comment telling me what is it that you feel medical students should know when they go into the clinical years? Or what do you wish you had known when you were starting, or what you wish someone would have told you when you started. I do offer live video tutorials. If you're interested in that, check out the Patreon link down below, or email me on thehelpermedic@gmail.com. Thanks everyone for watching. See you next time.